is going on, ladies and gentlemen? Welcome to the Gravity Podcast. I am one of your hosts, Chris. Thank you for choosing to tune in today. Hey, folks, we're back at it. How do you stay grounded in a world full of noise and chaos? What are your foundations? What are the things that help you maintain perspective when life gets weird or crazy or stressful or whatever it is for you? For Jaimie and I, we come back to our faith, our family, our core values. These are the things that help us stay grounded when the world gets really crazy. Today's guest, I'm super excited about today's guest, folks. It's Dr. Xavier Amador. I was at a conference in Boise, Idaho. It was a crisis intervention training conference for the Pacific Northwest. It involved police officers and mental health professionals, and he was one of the keynotes. And listening to his story, and first of all, he's a clinical psychologist. He's authored a number of books, and really the heart of his work at this point in his life, I shouldn't say in this point, it's been for many years, is his brother. His brother had schizophrenia and didn't know it. And trying to convince your family member, hey, you're mentally sick, you need medication, is really hard. In fact, there's a difficult word. I'm going to give it a shot. Anosognosia is what it's called, where you don't realize that you have this thing. And it pertains to other things other than just schizophrenia. But it really caused Dr. Amador to get curious with what research said. If pretty much, is there another approach to this? I'm going at my brother. Is there another approach? Because this thing isn't working, right? It's that old adage of, or I think it might be an Einstein quote, doing the same thing over and over again and expecting different results. That's the true definition of insanity. Folks, before we listen to Dr. Amador, I want to talk about the hat that I'm wearing on the YouTube version of this podcast. I'm wearing my Deer Hollow hat, folks. You've heard me talk about them before. Deer Hollow was the PTSI recovery center that I went to back in July of 2023. And what I loved about Deer Hollow is from the initial phone call, when I called the intake person, the love, the empathy, the support that they conveyed to me was tremendous. I was not an easy client always. When I was there, I got huffy and puffy at least a few times, and it would have been easy for any other human being or staff at some facility to say, you know what, you're being a knucklehead. You want to leave, leave. But instead they gave me space. They let me deal with what I had going on, and then they stepped back in to re-engage me and work with me so that I could heal up my brain. Folks, I don't know whether Deer Hollow is the right place for you or not. They are first responder focused. I think they do great work. Their contact information is down in the show notes, their website and their phone number. Jot it down. It may be for you. It may be for one of your loved ones. I don't know. With that, folks, let's get into this interview with Dr. Amador. Dr. Xavier Amador, welcome to the Gravity Podcast.
Thanks. Glad to be here, Chris.
I really appreciate you being willing to come on the show. I know that you've been interviewed by a number of media outlets for the work that you've done over your career, and I am certainly not at the magnitude of some of those. However, I constantly get feedback from folks, especially connected to the military or the first responder community, on how the content from the guests that come on the show is helping them, making their lives better. So I really appreciate you being willing to give them some of your time.
I'm glad to be here. Thanks.
Hey, before we got going there, you helped me with your first name, and you said there's a story there. If you don't mind, your first name is Xavier. If you don't mind, but it's spelled with an X, which just gives it a good story to tell.
Yeah. Well, I'll tell you this. When the X-Men came out, I was a professor at Columbia University, so everyone started calling me Professor Xavier, which was fun, you know. But no, I was born Javier Actually, my name is Francisco Javier Amador Sanchez. It's a Spanish name. I was born in Cuba, and our father ended up getting killed in the revolution. He was pro Castro and then flipped on Castro when Castro flipped on his supporters and promised democracy and delivered communism. So my father was killed, and we escaped. When we landed in Miami, I'm a Cuban refugee. When we landed in Miami, some nameless customs official took the Javier, Javier, and changed it to an X. So I became Xavier because we went to Ohio for a long time. I lived in Ohio, and I was always called Xavier there. But my name
Okay.
is Javier, so thank you for saying that.
And thanks for being willing to tell the story. I've done a number of, I've put a lot of work into genealogy, and
Uh-huh.
I have found similar stories in my family line of names that, including my last name. It was not usually spelled with an I, it was usually spelled with a U, Lutt.
Latrell,
And around the 1850s, 1860s,
right?
that's where I see the change in the census record. So I don't know if there was literally a family feud where they changed a letter for that purpose, or if it was literally just someone on a census record who made a mistake.
Or somebody running from the law.
It may have been that. I want to know that story. That would be a very interesting story to tell.
Yeah.
Speaking of stories, Dr. Amador, for folks that haven't heard your voice before, do you mind giving a short introduction of who you are?
Sure. So Javier Amador, I'm a clinical psychologist. That's why people call me doctor. I was Javier a lot longer than I was ever a doctor. But I taught for many years at Columbia University in New York City, where I did a lot of research on bipolar disorder, schizophrenia, depression. And the main focus of my research was trying to understand why so many people with these illnesses said, I'm not sick. I
Mm.
don't need help. You're the crazy one, not me. When I would try to help people with these illnesses, I got a lot of defensiveness, a lot of anger. And before that, I encountered this circumstance, this problem with my older brother, Henry. When we immigrated from Cuba, without a father, Henry, 8 years older than me, was my best friend. He was
Yeah.
he really listened to me and taught me how to throw a baseball, how to ride a bicycle. And when he developed schizophrenia, I tried to help him, right? Hey, Henry, you're hearing voices. That's not normal. Something's up. He had a delusion that he had killed our stepfather. My mom remarried. Our stepfather died from a heart attack. Um, and he was absolutely certain that he had killed him by playing the guitar, this bizarre delusion. So I tried to get him help. And he kept saying, I'm not sick. There's nothing wrong with me. Leave me alone. I ended up having to call the police. This is in Tucson, Arizona, back in the early 80s. And the officers were fantastic. I met him out front and I said, hey, guys, doesn't have a weapon. He's not threatening anybody. He is talking about suicide. But again, there's no weapons. Please help my brother. And they were freaking fantastic. So they got him to the hospital and he got well, got antipsychotic medications. My definition of well, he stopped hearing voices. He stopped, being certain he had killed our stepfather who he loved, awesome guy.
Yeah.
And took him home after a month in the hospital. My mom makes dinner. I'm doing the dishes and I go to throw something out under the sink. And what do you think I found there?
Wow, the pill bottle.
Yeah, exactly. So, I fished it out and I don't know if I banged or knocked on his door. I was pretty pissed.
Yeah.
With my mom, we had all just been through another loss, with our dad
Yeah.
dying. And I didn't understand mental illness. So I said, what the hell's going on? Why aren't you taking the medicine? And he says, I don't need it. That started 7 years of us butting heads and arguing and me thinking my brother was irresponsible and in denial.
Mm.
So this really pushed me to do research when I was at Columbia University and did a lot of research and proposed to the field way back then. This is 1990 in a paper that what we're seeing in people like my brother Henry is not denial. It's not stubbornness. It's not somebody being difficult. Or I used to call him an asshole sometimes, really, in retrospect, I would have done things really differently. I didn't call him that more than once, but I remember calling him that once. People are suffering from another symptom of the brain disorder, like a delusion or a hallucination. And if somebody's hallucinating, I know they're not choosing to hallucinate or have a delusion. And he wasn't choosing to refuse treatment. In his mind, absolutely did not need treatment. So to answer your question, that's not a very brief introduction, but in terms of my career, where I've really focused, because Henry and I got back together, I approached him really differently after I understood this was a symptom. I apologized. I said, I'm sorry for all the times I told you that you had schizophrenia. That's what he was diagnosed with. Sorry for all the times I told you you needed medication. I'll never do those things again. I kept that promise. And within a few months of me shifting how I talked to him, which was really by listening to him, asking him what he felt he needed, and not telling him that he was wrong, within about 6 months, he accepted medication, which he stayed on for the rest of his life. An injectable medication, no less, a monthly injection of antipsychotic medication, and did really well, recovered, got 2 volunteer jobs, a girlfriend, a life back. Because he had been homeless for those years that we argued. His life was really dark and empty until he accepted treatment. But he never, this is the interesting part, Chris, is he never understood he had mental illness. And I asked him,
keep going. I'm sorry.
Well, I asked him, hey, Henry, if you don't, I asked him last time we had a face-to-face conversation, I said, because he knew I talked about him. I wrote a book called I'm Not Sick, I Don't Need Help, which is his story and also and research and other things in there. And he knew I talked about him, and the book's dedicated to him. And he was very proud of his little baby brother. He always called me this baby brother. I said, people ask me, does your brother understand he has schizophrenia? And I said, I haven't asked him that in years. So I asked him, and he laughed and he said, no, I don't have schizophrenia. I said, so why are you taking these injections, every month? And he's, his answer is at the heart of my work, really. He said, I do it for you and for mom and pops. Mom and pops, their names are Betty and James, ran the halfway house he was living in. And they were loving, sweet people,
Yeah.
So what's his answer? He's in treatment, not because he understands he has an illness. He's in treatment because of relationships. And
That's
so
powerful.
really powerful. And that's the second part of my work, which was developing ways of communicating with people who have mental illness that engage them with us. So, we teach first responders, we teach police officers, paramedics, 911 dispatchers. We teach family members, people like me who have a loved one. And then we teach mental health care professionals what's called the leap approach, which is first and foremost about listening to the person and valuing and validating their experience. Stop telling them what's wrong with them and start listening. I mean, there's much more to the approach than that, but that's the pivotal piece.
That's so universal. I feel like in relationships in general, in reference to being an active listener, what keeps us from doing it as humans, whether it be with our loved one in mental illness, police officers, firefighters out in the community, or just with with your wife or your husband. What keeps us from being able to do that?
I don't know if I've been asked that question before. And my first thought is going to sound backwards, and let me think it through with you. I think the reason we don't listen is we want to be heard.
Okay.
Ironically, like I was going to say, it's because we have an agenda. I have an agenda, right? And I want to get that agenda across. But if I have an agenda, that means I want to be heard. I want you to understand my position and what I want to do.
Yeah.
So I'm so busy wanting to be heard that I'm not listening to the other person so they get heard. I've never been asked that before. It's really, really interesting.
What did it take in? I mean, you have this experience. You said it caused you to get curious with research. What type of research was it? Studies that you were running yourself, or was it you reviewing other people's studies? Yeah, where did you go to start getting this knowledge before you arrived at this conclusion that
Right.
Leap Institute offers?
Both things. I read a lot of research, and I ran across motivational interviewing. I don't know if have you ever heard of that?
I don't think so.
It's it's a psychotherapy that's been around for 40 years now, to engage people with substance use disorders in treatment. And one of the kind of cornerstones of motivational enhancement therapy or motivational interviewing is listening to the person and working with their goals. Um, and then I had a grant with Aaron T. Beck, and some listeners may know Dr. Beck is the father of cognitive psychology. He's the one who invented it back in the 50s. And Dr. Beck and I had this grant to do this 6-session inpatient psychotherapy for people like my brother Henry, people who lack insight, seem to be in denial. And I realized pretty quickly, I mean, well, we were training therapists for the study, right? So we had 2 postdoctoral fellows in psychiatry, we had a PhD psychologist, and then we had a junior in college who was a volunteer. And we were inviting her to get trained, even though she wouldn't be a therapist in the study, by the very famous Dr. Beck and by me. So it was like, it was payback because she was
Yeah.
doing data entry all day long. And what was really interesting is as we were teaching our 6-session short-term psychotherapy based in part on motivational enhancement therapy, the trained people had a really hard time doing it. This junior in college got it like that. So I realized that there was a communication program in there that could be taught to anybody, and I lifted it out of the therapy. And with Dr. Beck's blessing, he said go for it, and I wrote the book that I mentioned, and then started doing research on it, and then eventually founded this institute 10 years later.
Wow. What was the timeline on that from you starting to get into, well, maybe with that study before you were able to re-engage with your brother with this new strategy?
7 years. It was 7 years of me um, basically trying to convince him, trying to strong arm him, trying to educate him.
Yeah.
And the irony is, the way I was trained as a psychologist is you do an assessment, you listen to people, but then you make a diagnosis and you tell them their diagnosis and give them tools for recovery, right?
Yeah.
Um, with somebody who has the symptom of unawareness that my brother had, every time you educate, you're just pissing the person off.
Yeah. Yeah.
That's like me telling you right now. You mentioned before we started recording that you're married, right?
Yeah.
Well, I'm actually here to tell you that's a delusion. I know you're smiling, but I've been asked, what's the woman's first name that you believe you're married to?
Jaimie.
Jaimie has asked me, Jaimie and her husband, John, have asked me to intervene with you. I've got restraining orders I can show you. And if I showed you those, would they convince you you're not married to Jaimie?
They would absolutely not.
What
26
if,
years,
yeah,
26 years.
what if, what if police arrested you, dragged you out? Are you in the house where you believe you live with Jaimie, right?
I am.
What if they came there, took you into custody, and they brought you before a judge and they said, look, you've got restraining orders, it's criminal trespassing, and we're going to give you a choice of mental health treatment or we go to trial. What do you want to do? What would you choose?
At that point, actually, I don't know what I would choose because I can be stubborn, but I also sometimes will look at the long game.
All right, well,
I don't know.
I'm the judge. I'm the judge. I'm the
Yeah.
judge. Mr. Luttrell, I've got a full docket. I want to help you. We can go to trial on criminal trespassing, violation of restraining order, or you can go to our pre-trial diversion program, get some treatment in a psychiatric center. Sir, you got to make a decision. What do you want to do?
Go to trial because I'm not guilty. I'm
Okay.
married to this woman. We've been married 26 years. We have 4 daughters
Right.
together, Your Honor.
I know you believe that. I'm going to adjourn this case. We have an arraignment tomorrow. So you get arraigned,
Yeah.
you get found guilty, you're put on
Yeah.
probation. Where do you go after you leave your PO's office?
I'm probably going back home.
And then you get arrested again. So
Yep.
this goes on for a whole year. I'm almost done. This goes on for a whole year. Do you think after a year you'd finally believe you're not married to Jaimie?
Probably not. Not with a
5 years.
26-year memory. I probably
Right.
would never.
That's what this symptom is like of
Wow.
unawareness. Yeah.
Wow.
It's got a tongue twister of a name. It's called anosognosia. Anosognosia. It is this profound lack of awareness that you've got anything wrong with you. So we see this in schizophrenia. We see it in substance use disorders. It's really stemming from frontal lobe dysfunction, executive
Okay.
dysfunction of the brain. But the belief that you're married to Jaimie is as it's in your bones. You know you are, right? Same thing with my brother and about 6 million Americans.
Oh,
The
wow.
belief that I don't have any mental health condition is
Okay.
held as strongly as your belief that you're married to Jaimie.
Yeah.
So how do you reach that person? And that's what I was up against with my brother. You reach them by first and foremost, stop telling them they've got a problem.
Yeah.
And you ask them, tell me, what is your problem? What's your problem with me? Is there anything I can help you with? And then you do active listening, what you were talking about earlier. So what
Yeah.
you're telling me is your problem is that Dr. Amador, let's say it's you, your problem, and I'm your probation officer 5 years from now.
Yeah. Yeah.
But Chris, what I hear you saying is that when you did that podcast with that crazy doctor, he revealed that you weren't married to Jaimie, and everybody around him, including Jaimie's, agreeing with him, and your life kind of fell apart. Did I get that right?
Yeah.
I would do active listening.
Yeah.
That must be really scary. I'd
Yeah.
empathize. I'd empathize with that, and I'd normalize it. This is part of the LEAP approach. I normalize it by saying, Chris, if I was in your situation, I'd be pretty scared too, and I'd be angry. So the LEAP approach, the headline is stop listening, stop talking, and start listening.
Yes.
The thing I say to myself is shut up, listen, and you're going to win. And what are you going to win? You're going to win the person's trust and their interests in your opinions about maybe what would be helpful to them.
Wow. How long, when you transitioned, when you pivoted towards this approach with your brother, how long did it take before trust, maybe just the seed was planted? Maybe it wasn't this full-blown, beautiful relationship that you guys had years later, but how long did it take before you felt him engage with you?
Immediately. And that's why we teach this. This is why we teach this to law enforcement.
Yeah.
It was immediate de-escalation and relief. And he thanked me. It was a telephone call, so I don't know what he looked like, but
Yeah.
I've worked with other people and I see them tear up, like, thank you. Because he had been all alone. Everybody around him was telling him he had schizophrenia, especially me, but not just me. Our mom was telling him that. Doctors were telling him that. Police officers would pick him up because he'd be walking in 110-degree heat in Tucson, Arizona, in the middle of the desert, and they'd pick him up to help him, and they'd bring him to a hospital. So they were telling him he had an illness. So here I was saying, I'm never going to tell you again that you have an illness. I promise. And so immediately you get, a small measure of trust, but a large dose of relief. The person just doesn't have to defend themselves anymore. But it took about 6 months of this change in me to help him decide to accept this antipsychotic medication, given by injection. It took about 6 months, but he stayed on it for the rest of his life, for almost 20 years.
Which says so much right there, especially when you asked him, do you know that you have it now?
Yeah.
Why are you taking the medicine if not?
Right.
And it be because I care about you and you want me to, and I know it's going to make you feel better.
Yep. Yeah.
Wow.
Which is totally counterintuitive. I mean, think about it. Taking this psychoactive medication
Yeah.
that's in your bloodstream for a month, monthly injections, you
Yeah.
know, and that's the thing I love about what we do is that it feels like magic often, you know, and it's the power of trust and the power of relationships to engage people.
Yeah. And I've seen this not with that anosognosia. I've seen this just with folks struggling with post-traumatic stress injury, post-traumatic stress disorder symptoms.
Yeah.
If you're the first person that they trust to tell some of what's going on in their mind,
Mm-hmm.
and when you listen and empathize, and especially when you can look at them and go, either I've experienced similar symptoms or I've
Right.
listened to a lot of other people that have experienced similar symptoms, seeing the relief on their face that you mean I'm not busy. This is what I've
I'm not
seen from
alone.
I'm not alone.
Yeah.
We go and throw labels on it, unfortunately. You mean I'm not crazy, which I would argue is the case for a lot of these things. No, crazy is this word we throw on things because we don't have a vocabulary for it. I love the way you
Right.
keep saying, I'm trying to remember how you were describing anosognosia a second ago. You said something about, you called it a symptom, this
Mm-hmm.
lack of remembering symptom or something like that. And I think that's beautiful.
Unawareness, lack
Unawareness
of
symptom,
awareness. Yeah.
lack of aware. That's a really beautiful way to an accurate way from me not being educated in this, but just an accurate way for me to see it, I guess, from the outside looking in of what's going on versus you're a problem versus
Right.
you're denying it. If you're denying it, you're a
Right.
problem. You're a liar,
That's right. That's right. Deep down, you know it's true what I'm saying.
Yeah.
You know, if you're in denial. No, it's not denial. It's a neurocognitive symptom. Just like, let's say I had a movement disorder, that's a neurocognitive symptom.
Yeah.
It's the same thing. And do you know that there are people with movement disorders who have anosognosia? So you see my hand shaking? I'm doing this on purpose.
Yeah.
With tardive dyskinesia, for example, about half of all patients with that movement disorder are unaware they have anosognosia.
Mm.
So back to your question about what I started to study, when I started studying the root of the problem, I was reading a lot of neurology. I did a year in neurology service. I worked with a lot of people with concussive brain injuries with TBIs and ran across many, and we've done some research as well, who were just unaware of their neurological symptoms. So
Wow.
it's you know it cuts across a lot of brain disorders, and I see it in PTSD as well. You know
And how
that
does it
kind of
manifest itself in PTSD? Is it just in denial of having PTSD itself, or is it other aspects, or is it just like, is it really broad, the types of ways
it,
that it manifests itself?
it's more broad in PTSD. It's it's an unawareness of the significance of the experiences that you're having. So you're
Okay.
having flashbacks, you're getting depressed, you're getting suicidal,
Yeah.
and it to the rest of us, it looks like minimization, like he's just minimizing, he's in denial, he just doesn't get it, um, uh, isn't weighing it. But the part of our brain that alerts us to danger and says, "Hey, something's wrong," is just not working in that scenario, in that situation. So the person doesn't appreciate. There's another symptom called anosognosia, but basically it's a lack of appreciation for the experiences that the person's having. It's not that bad. It's really okay. You know?
Yeah. Well, I could see that one right there.
Right.
I could see the I have a big emotional reaction and I feel like it's very justified. Or is this something different? Would that fall in the same category, do you think? Or is that something like I have a really big emotional reaction because someone cut me off in traffic and I feel super
Traffic.
justified the way I responded, and everyone else is going, whoo, you
Ooh.
responded really inappropriately.
Right.
That was way over the top. I don't know. Is that
Right.
something totally different, or is this kind of the same
It's
ballpark?
it's kind of related. I mean, when you look at anosognosia for aggressive, violent behavior, it
Yeah.
exists. So you can see people with serious mental illness, and again, with law enforcement, first responders, I do a lot of this work, making sure they understand that this person is likely. There's a 50% chance they have no idea that what they just did was incredibly poor judgment or aggressive or even violent.
Yeah.
Um, so Yeah, but it's also, it's the fight or flight response in our brain. I mean, when someone's tailgating me and I'm doing 70 miles an hour on the highway and I have the urge to tap my brakes hard because I'm getting really angry about what I'm seeing in my rearview mirror,
Yeah.
that's my fight or flight.
Okay.
That's the amygdala. That's another part of our
Yes.
brains. And the amygdala is, firing off. You're in danger. Do something. So my impulse is to fight. I'm going to hit the brakes hard. I'll show this mo. What's what. But then my frontal lobes kick in and say, "Whoa!" and they put the brake on me, putting my foot on the brake.
Yeah.
So if your frontal lobes um, are dysfunctional or underperforming, you don't have that, that governor, that braking system.
Yeah.
And that's what we see in anosognosia is hypofrontality, frontal lobe dysfunction. So there's a constellation of symptoms. So the short answer is it's kind of, yeah, it's relevant what in the scenario that you just described.
Yeah.
It being anosognosia is relevant. Yeah.
I love it. So tell me more about LEAP, the LEAP Institute, and this training that you offer. It sounds like you said first responders, mental health providers, just the general community, especially when they have loved ones who might be diagnosed with mental illness. Is it in-person training? Is it online training? Is it hybrid? What does this look like?
Well, there's free videos on our website. I'll give the website later if you like. And so you can get some introduction to it. And then there's a couple of books. But the trainings themselves are sometimes they're blended. So sometimes we'll have law enforcement, mental health professionals, and family caregivers in the same room. Other times they're specialized. But there's
Yeah.
two parts to the training. We teach people about anosognosia. We do the role play that I did a little bit of with you, with someone, excuse me, to give people the experience of what it's like to be all alone in your reality and nobody agrees with you, right? So we educate people about this being a symptom, not someone being in denial or difficult.
Yeah.
Then the second part of the training is the LEAP approach, and there's seven tools, and we do a lot of role plays. We role play scenarios, so people learn how to actively, reflectively listen. And the way the LEAP does it is very rarefied. It's different than motivational interviewing or other kinds of reflective listening that people learn. And then we use strategic empathy around specific feelings. That's the E in LEAP. A is we look for areas where we can agree with the person. So we're not going to agree that they're mentally ill if they have anosognosia. So then
Yeah.
what? Well, staying out of the hospital, getting a job, finding love. I mean, there's so many things we can agree on, finding work. And that's what we partner on. And then there's three other tools that really are all aimed at respectful, non-judgmental communication. So the person feels heard. We all want to feel heard.
Yeah.
That is I think, unassailable truth about our humanity. We all want to feel heard and seen. So LEAP is all about really seeing the person and really hearing them, and through that gaining their trust and their willingness to try on what we're suggesting they try on. I'm not
Was it-
persuading anybody. I'm not persuading anyone to do anything with LEAP.
yeah. You're trying to
You know?
draw it out of them, is what I'm hearing you say. It's
Yeah,
their idea, and you're just trying to help them come up with this idea.
it's very Socratic. The Socratic method of asking questions, asking the person to problem solve, and then asking, never giving your advice. With the LEAP program, you never give your advice unless it's been asked for or you've been given permission.
Okay.
So if you and I were working together and I was using LEAP, I'd say, hey, Chris, I have a suggestion given what you've just been talking about? Would you like to hear it? Then I give it when you say yes.
Yeah.
And people almost always say yes.
Yeah.
And if they don't say yes, that's okay too. No, I know what you're going to say. You're going to say I need to just see a psychiatrist. Then I would reflect back. So what I hear you saying is, I'm just going to tell you what everybody else has been telling you. Is that right? Yeah. It sounds like it pisses you off, does it? Yeah. I'd be pissed off too. So I just listened and empathize.
Yes.
Right? Okay, I guess you can tell me what is it? That's often the result when I'm genuinely curious and respectful of somebody's experience, they start to become curious about what I think, you know.
Yeah. Do you see either in your own experience or in people communicating back to you their experience in using Leap, is there, at least early on, is there this tension of, I'm trying to draw it out of the person, but it's not working right now. I need to abandon this and just go back to what I know works,
Right.
and that's me telling you what to do.
That absolutely happens. And I do a lot of family consultations. I'm working with about 10 families every week. All right. And it's almost all virtual. And when I get that response from somebody, this is the question I ask them. How many years have you been trying to convince your son that he's mentally ill?
Yeah.
Oh, about 10 years. Is it working? No. So who's the insane one? Einstein's definition of insanity, right?
Yeah.
Doing the same thing over and over and over again, expecting a different result. And that really gets people to get comfortable to learn this very counterintuitive approach, because you don't educate with Leap. You don't tell people they have a mental illness.
Yeah.
And they go need to go see a psychotherapist for their PTSD, or a psychiatrist for their bipolar disorder. We don't say that unless the person forces us. Well, are you saying I have bipolar disorder? And then one of the tools in the LEAP program is how to give your opinion that preserves the dignity of the person you're talking to. So if somebody asks me who has anosognosia, who has unawareness, do you think I have bipolar disorder? I would say, look, you've asked me, so I'm going to answer. I'm sorry, I could be wrong. I think you do have it. I don't want to argue with you. Those are 3 A's. We apologize, we acknowledge our fallibility, and we ask the person to agree to disagree, to not argue.
Yeah.
So it's really easy. It doesn't take more time. Hey, I'm really sorry, Chris. You've asked me if I think you have bipolar disorder. I could be wrong. I don't know everything. I think you do have it. But I'm not here to argue with you. I'm not going to try to convince you that I'm right. Hey, I could be wrong, but that's my opinion. Even as a doctor, I give that. And people will say to me, yeah, but you're a doctor. What do you mean you could be wrong? I'm like, look, I'm humble. I could be wrong. I don't think I'm wrong. I mean, you've asked me. I don't think I'm wrong, but I could be, And it's easier than saying, yes, I've done my diagnostic assessment. It's clear to me that you have bipolar disorder and need to be on medication for the rest of your life. Real different way of communicating.
Do you find yourself using some of these communication tools in everyday life as well?
Yeah, absolutely.
I mean, this is good listening skills.
Well, I have another book called I'm Right, You're Wrong. Now what?
Yeah.
And that book is all about LEAP. And what happened was, when I started using this program, teaching mental health professionals, first responders, law enforcement, families, people started coming back to me afterwards and saying, hey, would you help me? I'm having this trouble with my employees, business owner. I'm having this trouble with my teenager. I'm having this difficulty with, boom, 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 different scenarios with my father who has dementia. So I've had about 20 years of experience teaching LEAP and using LEAP in all kinds of scenarios. I mean, my wife and we use LEAP with each other. When we start getting pissed off at each other, and whenever you repeat yourself more than twice, you're at an impasse. And once you're at an impasse using these tools, which I didn't invent these tools, these are timeless psychological truths, like listening, right? Do you really need a psychologist to say, hey, it's really valuable to listen? But I've kind of put them together into a toolkit, a tool belt, of sorts. So my wife will say to me, you're not listening to me. And we'll both crack up laughing. I was like, let's start over. When we get into the I'm right, you're wrong, butting heads impasse, it's time to stop and take a breath. And what I say to myself, I'm a little harsh. I just say, Javier, shut up and listen. You're going to win. And what am I going to win? I'm going to win the relationship.
Yes.
Right?
Yeah.
And then from there, you can problem solve. From there.
Yeah. One of my wife and I, we haven't done it for a while just because of a number of life events that have happened over the last year for our family. But my wife and I previously would record every other episode as a Marriage Monday edition. And we would literally we would hit record, and sometimes we would be in active conflict, meaning we had made up enough that, like, but we hadn't got into the root of what caused the conflict, and we'd hit record and
Right.
do it. And there was tons of accountability then, because we talk on the podcast about being a good listener to the other person and empathizing with the other person.
Right.
And we have a better relationship when we do that stuff. I had a friend give me there's a nonprofit called Stronger Families, and they have a document that they use called a couple log, kind of like a dialogue, but for
Okay.
couple log. And it's kind of like the old book where you have to have the conch. What book was that? Well, there was a book I read in high school, a literature book, and these boys are stranded on an island, and in order to
Oh,
talk, you're holding the conch.
Lord of the Flies.
Yes, Lord of the Flies. And
Yeah.
it's very similar to that in that there's one speaker and there's one listener. And for whatever reason, if we step into an argument or a conversation without that, we oftentimes don't step into those roles. We forget that we're on the same team, Dr. Amador.
Hmm.
That's the
Hmm.
thing. You're in the same
Right.
team as your spouse. I don't think the
Right.
Yankees right fielder is ever looking at the left fielder going, I hope he drops the ball in this net. I hate his guts. I want to lose the World Series right now, and I
Right.
want to see him do
Right.
it. No,
Right.
even if you don't like them a bunch in the moment, you want them to catch the ball. You want them to get the
Yeah.
out. What are we really looking for in our relationships? Are we trying to win? Because if you're trying to win, that means the other person has to lose. And if you're on the same
Yeah.
team,
Yeah. Being right. I love that analogy. But, being right is overrated. I would much rather have uh, a loving, trusting relationship. I'd much rather be happy than be right. If
yeah,
that makes sense.
it makes a ton of sense.
Right, in a conversation with someone. Yeah, I saw that you do the Marriage Mondays things. I'm gonna have to listen to one or two or three.
We
Might help
we
me.
we have a lot of fun. Actually, I get more positive feedback from those episodes. Like, I mean, the guests that I interview as well,
Right.
people will say, "Oh, that guest really helped me with this." But I've had a lot of people be like, "Hey, I really like it when Jaimie's on the podcast." I really like it when Jaimie's on the podcast too. Uh,
Yeah.
right now, we're just not in that season. We're working through that, but right now, we're just not in that season. So
Well,
if folks were like, "Hey, I don't have anyone in my family who's battling mental illness," if I heard you correctly, you said that the book "I Am Right, You're Wrong, Now What" might be a really good starting point because it's going to offer
yeah,
this perspective from all relationships.
it does. I mean, it teaches you how to use the leap approach. It teaches you how to check in with your own feelings when you're in the conversation. And I teach you how to recognize when you've hit an impasse, because oftentimes we just roll over, you know, the
Yeah,
person who's on our team because we don't feel like they're on our team and they've got it wrong. And so there's warning signs, repeating yourself too much, name calling, interrupting
mm,
so there's that part of the book. Just recognizing when maybe it's time to step back and try to use the tools that are described in the book. But yeah,
yeah,
I'm right, you're wrong, now what is definitely a good starter. And but if you're trying to help somebody with mental illness, any kind of mental health condition, then I'm not sick, I don't need help
is
is
a
more
good start.
appropriate. Yeah.
How about for law enforcement or firefighting agencies? If they're like, you know what, books are great, we need you to come out and train us.
Yeah.
What's the way that they connect with you for that?
Just go to Leap Institute, one word, leapinstitute.org. And it's really easy to contact me directly. It's easy to set up a training. So we do a lot. We've trained thousands of police officers and first responders, tens of thousands probably at this point,
Yeah.
and family caregivers. Um, but yeah, just go to Leap Institute. And if you want to if you want to learn more before you reach out and ask about a training, there's a TED talk that I did that's under resources, free videos. It's 18 minutes. Um, maybe just have a look at that. And there's lots of videos there. Different role plays, like this young woman finds her husband's medicine for bipolar disorder in the garbage can, and she goes out and talks to him. So we have a video where we show her sort of approaching it in the common sense way that I did with my brother. Like, hey, why aren't you taking your medicine? And you see how it plays out. And then we shot it again with her using the LEAP approach, so you can really see the contrasts. There's all kinds of videos there. But if you want a training, definitely just go to leapinstitute.org. Yeah.
I love it. And you said were those the videos that you referenced earlier? I know you said there were some videos
Yeah.
on the website.
Yeah.
And then how about for the books? I'm assuming they're available on the website, on Amazon, pretty much
Yeah.
everywhere books are sold, type of thing.
Yeah. Yeah.
I
Yeah.
love it.
On our website, I think I think there's a tab for books, and you can order directly, or just go to Amazon. That's, I mean, that's what most people do. That's what I do.
I'm kind of out of order here, Dr. Amador, so forgive me, but I had another question pop into my mind.
Okay.
I asked before, what is the challenge that makes it to where we don't listen? How about, I mean, you've trained a lot of folks. What do you see as the stumbling block that keeps us from considering using this new technique? You know what I'm saying? I mean, I've been a first responder for 25 years. I'm a third generation cop. And I know sometimes when we hear stuff like this is what we do.
Yeah.
And this is only viewable for the people on YouTube, but we cross our arms and we think,
or you're holding onto your vest. Or
oh,
that
the
one. That's
best.
the big one.
Yes.
I teach officers right away. Hey, put your hands out, man. Let go. Yeah.
Yeah. We put our hands up there on those darn vests.
You know what stops you from doing it?
What?
Your expertise.
Oh, yeah.
You know a lot. You know a lot. You've been trained. You've got experience. Your expertise keeps you from stepping back and saying, tell me what's going on. Putting your hands up like this, universal sign that you're not a threat. Tell me what's going on. I'm going to try to help you. I don't want your effing help. All right, you don't want my help because at least tell me what's going on. You engage the person.
Yeah.
But it's our expertise. Look, I've got lots of training. I've got a tremendous amount of training. I'm accomplished, right?
Yeah.
My opinion is not more important than the person I'm trying to help. Their opinion about what's going on is way more important than mine. So I've got to get humble. Yeah, I've got a lot of experience and training and expertise, but if I'm talking to you and I'm trying to help you, the only opinion that really matters is your opinion. So we got to get humble. We got to realize that you can't utilize your expertise unless you've got a willing person.
Yeah.
Right. But I think that's what stops us. Yeah.
Is this much like what you said, that junior undergraduate was more successful compared to the postdocs because they knew too much almost?
She didn't have to unlearn all the things that she had learned.
Yeah.
Right. Thank you for doubling back to that, because that's how I usually tell that story. She did not have to unlearn all the training that the senior doctors had in that study. They had a really hard time understanding how to take this approach at first. Like, aren't I going to make the delusion worse if I reflect back? So your problem is the CIA and they're surveilling you. Did I get that right? Aren't I going to make it worse? No, you're not. Delusions are fixed false beliefs. I can't make it worse by joining you. Now, I'm not saying I agree with you, but I'm reflecting it back and saying, is that scary? Yeah, I'd be scared. I'd be scared too if the CIA was surveilling me. Well, do you think it's happening? Well, then I give my opinion. Hey, I'm sorry, I could be wrong. I don't see that it's happening, but I don't want to try to convince you of anything.
Yeah. I saw this same problem. I was in the Air Force. I was a firearms instructor. And guess who was my best shooters? The 110-pound female that had never seen a gun in her life. Because, or male, gender didn't matter. But the point is the person who had zero contact with firearms usually would qualify with no problem, sometimes shoot expert. And the people that were on the struggle bus were my hunters, my folks that had been shooting their entire life, and they wanted to tell me how they knew it all. And then I would see them struggle because they weren't listening.
Yep.
They weren't students.
And with that kind of experience and knowledge comes habits. So you have to break a habit to learn how to do it.
Well, I thought about
interesting.
You said before, active listening, we're not interrupting. That goes completely against the interview and interrogation techniques that I was taught, where I'm supposed to build a theme And when they start to try to deny it, I interrupt them and say, hold on a second. This is really important. I need to get to this. And I continue to develop the theme until I see the change in their body posture. And then I hate to say it, but I go in for the kill.
Yeah.
So you only did this a little bit, right? You only did it. Oh, yeah, I only did it a little bit. Thank you so much for telling me that. But it's a different technique for a different time. That's the thing. I'm not hearing you say that LEAP is the only way we're ever going to communicate in our lives. What I hear you saying is there are very unique times, whether we're engaging someone with mental health crisis, whether we're engaging our spouse and we're just in conflict with each other, that we can bring these tools to the table and have better outcomes.
Yeah, it's to augment what you already know.
Yeah.
And I have one more story to share if we have time.
Yeah, we do.
I've done a lot of work for the DoD and the DOJ, and I've got security clearances. And I was at Gitmo interviewing a terrorist, and nobody was getting anywhere with this guy. Nobody. I was the third person to come in to talk to him outside of the interrogators. And the first thing he said to me was, "How do I know you're not CIA?" I leaped him. I reflected back and said, "So you want to know how to know if I'm CIA or not?" He said, "Yeah. How do I know you're not?" I said, "You have no way of knowing. I could be." I just joined him where he was. We had 3 days of interviews over 9.5 hours. I was the first person that ever got this guy talking. Right. So even interrogations, it's a funny thing that you bring it up. I've never shared this story, I'm sure, in any interview or podcast. Even in his case, just validating his experience and really hearing him and having him feel heard, he opened up. And it's counterintuitive, right? Because I'm not saying whether I'm CIA or not, but I'm acknowledging that he's got a fear about that.
Yeah.
And of course, he should have a fear about that. Yeah, he should have. He was interrogated by the CIA a lot.
Yeah.
You know,
wow,
this wasn't
powerful.
one of them.
That's powerful.
It was an amazing moment. Yeah.
Well, I hope for the listeners, they're doing what I'm doing. They're scanning through their relationships in their life, and if there's any strains, they're asking the question, "Can I make it better?" Well, we can continue to do what we've done, and we are going to have probably the same outcome that we currently have, or maybe we can try something a little bit different and see what happens. Dr. Amador, for folks that hadn't heard your voice before, you've already mentioned the website. Is that the best way for people to connect with you?
Yeah, I think leapinstitute.org. Also, there's Dr. Amador. I think it's .com. I hope so. Yeah. And that's a much larger kind of vista of what I do and what I've done. And then there's a link there back to leapinstitute.org. But dramador.com also. Yeah. I don't do Instagram. I used to, and then I messed it up. So, and then somebody hacked my Facebook. So that's down.
Yeah. It's exhausting. Yeah. It's exhausting.
Yeah.
I do it because it keeps me connected with people that I don't live near anymore, from military friends to other things. But from a business perspective, I really don't do it, at least not like the influencers out there do. So, well, for the listeners, I'm going to make that easy. Look down in the show notes. Both of those links will be down there. Dr. Amador, time is my greatest commodity. I can't make more of this stuff. And you, sir, have given me a lot of yours. Thank you so much.
Thank you.
Have a great day.
You too.
Wow, ladies and gentlemen, what did you think of that interview? I heard this guy talk, so I knew he had great perspectives to bring to the table. And then it's like I forget. It's when I invite guests to come on the show, I forget some of the content they're going to talk about. So as I'm listening to it, it's like I'm hearing some of the stuff for the first time. And I'm just going, oh man, this is good stuff that I can apply in my life. And I'm thinking to myself, I'm hoping it's stuff that helps you in your life as well. Hey folks, Jaimie and I want to hear how we're doing here on the podcast. There's a few different ways for you to communicate back to us. First and foremost, please follow us on whatever podcast platform you're listening on. That will cause the next episode to come up on your dashboard. If you're listening on Apple or Spotify, there's a way that you can rate and review us. There's 5 stars waiting on our main page. We'd really appreciate a 5-star rating if we've earned 5 stars, folks. If we haven't earned 5 stars, keep your stars. Shoot me an email at chris@gravityct.com. Let us know how to make it better, future Marriage Monday topics, or guests for me to interview. Folks, we only get to live this life once. Let's go out and take care of the people in our tribes. Take care of each other.